I've been a patient assessor for the last 3 years. A patient assessor is a person that goes around the wards asking questions from a predetermined list on an iPad and establishing that the ward is run effectively and with care. We then talk with the patients and establish that they are happy with the care and attention they're receiving. I've been quite impressed with the impact. I was impressed at how quickly a suggestion to adjust the notice board was adopted, and the staff, by the time I went for the second assessment, I noticed that all of the boards had been changed and all the notifications that were on the board were in easy format. What I like most about Perfect Ward is the ability to speak with the patients, because in my previous experience the patient contact wasn't there. But with Perfect Ward we're able to get a clear impression from the patients of how they feel their treatment is going.
I have a very strong belief that patients and public should be involved in all levels of the NHS, from strategic policy through to service design and delivery, and I think monitoring of the service that patients receive is vital. The Perfect Ward app makes sure, first of all, that I don't miss anything as I go around. The app also has a facility to take photographs of any parts of the environment that would benefit from a visual recording.
So for me, it's about having someone external who has the patient's best interest at heart. I know the staff do, but actually it's that external set of eyes that can give us some information that's viewed from a patient perspective and a public's perspective. We know that we go into an area, and if you're in there every day, you don't necessarily see everything. So from that perspective, it's very useful. And patients will also, or families, will talk to someone that's maybe not caring for them in a different way. The ward staff have embraced having David as the patient assessor come on the ward, and I think that would be the same for any patient assessor that comes on. I think they appreciate that extra look that they don't necessarily see, and that supports them in what they can do.
From the first Perfect Ward visit, I was very impressed by the standard of care that patients were receiving, and to be honest, it was very difficult, as much as I tried, to find fault.
We now have 13 patient assessors trained to support us in delivering Perfect Ward. I think that having the patients involved in the Perfect Ward assessment has really added value to the overall audits and quality rounds that we deliver. We are really listening to our patient voice, and our patients are helping us to learn as an organisation, and we are really listening to them. They are the heart of what we do. We must deliver what matters to our patients.